I'd like to introduce Ellen from Rhode Island in the US, who's a patient of Dr. Pradeep Chopra. Thank you for joining me, Ellen.
My pleasure.
Could you tell us for what conditions you take LDN for?
Actually, I have two incurable conditions. One is called sarcoidosis. That's the easier of the two that I have. That means I have enlarged lymph nodes and granulomas in my lungs. I've been taking minocycline, a small dose of that, for a number of years now, and that's as long as I stay on that medication, it seems to be holding it into my chest area only, and that always has the potential of spreading. The other condition that is creating many more problems for me is called Ehlers Danlos. It's a connective tissue disorder, which means the collagen in my body has been defective since birth. And although you can take medication to increase collagen in your body, because mine's defective, there's really nothing they can do at this point until the cure comes along to resolve this. So what it means is I spend my life with subluxations. A subluxation is a partial dislocation, sometimes leading to a full dislocation, because ligaments and tendons are deformed. They're like overstretched elastic bands, and it gets worse as you get older. So joints get very loose. So at this time, I'm now recuperating from my 21st surgery, basically just trying to hold my body together, my structure together. I'm in and out of wheelchairs and just trying to live life with a condition that, at this point, there's no solution for. Initially just was working on my joints, but now it's affected my breathing because my trachea has gotten loose, and that can bend at night, even though I sleep in an elevated hospital bed and wear basically a BiPAP ST machine, which is like a home respirator. It forces air in and out. The trachea can bend, and now the sternum can also slip down on one side. So my breathing actually has gotten blocked at times, and I have a service dog, Maggie, that sleeps by my side. And fortunately, I'm lucky that she is aware of when this happens and is able to alert me and stimulate me back into a different position to get my breathing back.
Oh, that's amazing.
Yeah, that's kind of, and just 2 weeks ago, got another diagnosis, and that's now affecting the heart, and I'm leading to congestive heart failure. So it's an endless battle, and you just try to keep your head above the water, but I feel like I'm treading all the time.
Oh, dear.
Doesn't make any sense.
So how did you hear about LDN?
Well, it's funny. I didn't begin taking this until January of 2012, but a full year before that, Dr. Chopra had mentioned it to me, and, I was just this wise guy thinking, I don't want any more medication. What would I want to do that for? So for a full year, I pretty much didn't pay attention to this, and one by one, people I knew that were on it started to talk about the benefits of it. I'm thinking, okay, what am I doing? Mm-hmm. I'm an idiot. This sounds really positive. If it can't hurt me, it can help me. Maybe I need to try this. So I contacted him again and said, okay, I changed my mind. I'd like to try this out and see how it goes. So that's pretty much, that was in January 2012 that I finally reconnected with him about trying this.
Mm-hmm. So what did you notice when you first started? Did you have any introductory side effects or anything?
The only thing I noticed, I'm terribly, terribly drug reactive, to the point that I actually had a DNA drug sensitivity testing done, and I'm really not able to metabolize simple things, aspirin, Tylenol, anti-inflammatories, Benadryl, all the opiates, you name it. Insane to be given two conditions creating pain and yet not being able to really tolerate anything. So first of all, I checked through that program to make sure my body would be able to metabolize it. It came back positive. The one thing I noticed when I started it, and I only take 4 milligrams, that's my final dose, but I started at 1 milligram. I started very slow because I'm so reactive. The only thing I noticed is if I didn't drink a full glass of water initially when I took it, that I felt a little bit sick to my stomach, which was odd. Today, after a year of being on this, I can take it and not even drink anything except a sip of water, and I'm absolutely fine. I have once my body accepted it, mm-hmm. I've been great. It's been absolutely no side effect at all. But that's the one thing I did notice.
So how long did it take before you noticed any benefits?
I would say within a couple of weeks, I definitely noticed a huge change. And from that point on, wondered what the heck I'd waited for mm-hmm. so long to try it. It was pretty effective pretty quickly.
So what changes were they?
Well, the way I understand it, it's similar to the feeling you have when you have had a real good exercise and the endorphins are released in your system. It's kind of that sensation where you just feel happier. When it's very difficult for me with two medical conditions to say I've had a good day. But when I have a good day now, it's drastically different. It's an emotionally good day, too. I feel happier than ever, and I feel more productive. So it's a very definite change in my body. I mean, nothing's going to cure me from my other conditions, but it's helping me to cope and live a better quality life taking this very low dose of medication.
And what about your pain levels?
Pain levels, I'm doing pretty well with. I seem to be pretty leveled out with pain. Once I've gotten past my last surgery, which was in October, I'm actually doing pretty well. I'm staying on top of my medications, and I think it's probably helped me tolerate my pain better too.
Well, that's really good. What would you say to other people who are considering trying LDN, but like you, rather skeptical?
Don't be silly like I was for a whole year. When I think of that whole year, I could have felt this much better. And sorry, you can't go backwards in life. You have to only move forward. You can't look back and regret. But I would say, I hope somebody's listening to this, and if you're at all thinking about trying it, I would go for it. It cannot hurt you. I'm living proof of that. I am so reactive to everything out there. This drug is non-invasive to the body. It's so gentle, and the effects are so positive. I would encourage anybody to, if you have any issue going on, try it and see if it can't give you a better quality of life. It's really worth a shot.
Thank you very much, Ellen, for sharing your experience with us.
No, my pleasure. I appreciate the time to be able to speak.